All right, let's go ahead and begin. Once again, my name is Ethan Baldwin. I'm a policy analyst with the Division of Financial Regulation. And if you're here for the 2025 Individual and Small Group Health Benefit Plan Rate Hearing. So we'll go ahead and jump into the next slide. That's going to be our agenda. And we'll start with a welcome. Then we'll describe the rate review timeline, discuss other items reviewed by the division, market participation, the required coverages. We'll talk about 2025 maximum out-of-pocket limit, market-wide benefit changes, as well as a discussion of the actuarial review process. Then we'll transition to insurer presentations and rate discussions, followed by public comments. And then we'll provide additional resources and discuss next steps. And then we'll close out the hearing. So we'll go to the next slide. Welcome to the annual rate review hearing with the Oregon Division of Financial Regulation. My name is Ethan Baldwin. Again, I'm a policy analyst with the division, and I'll be emceeing today's hearing. Each year, the division receives and reviews individual and small group health benefit plan rates that insurers have developed for plans issued on or after January 1, 2025. This year's rate review hearing is formatted a little differently than past hearings. We're trying a new format designed to share important rate information with the public in a more understandable and relatable way. Later in the hearing, we will share how you can provide feedback about rates and the rate hearing process, and we appreciate all feedback that we receive. I'd like to go ahead and have division staff introduce themselves, including their role in the rate review process. Let's start with our leadership team. Would anyone from the leadership team like to?
Morning, TK Keene, Administrator with the division.
All right. Do we have anyone else?
Deputy Administrator for the division.
All right. Thank you both. Next, any managers on the call?
Good morning. Thank you. Oh, God.
All right.
It off to a good start this morning. Good morning, everyone. My name is Keith Turner. I'm the project manager with the Division of Financial Regulation.
Thank you, Keith. And then I'll turn it over to our actuaries.
Hello, my name is Michael Sink, Senior Life and Health Actuary for the division.
Hi there. My name is Tim Hinkle, also actuary to the division.
Hi, good morning. This is Inyo, and I'm actually in the division.
And hi, everyone. My name is Drew Bucks.
All right. Thank you. And finally, is there anyone else from the division who'd like to introduce themselves?
Yes. Good morning. I'm Rick Berry, the lead health forms analyst, and I will be filling in for Tasha Sizemore, the product regulation manager this morning.
And we thank you, Rick. Happy to have you. All right. So we'll go to the next slide. So now we're going to discuss the rate review timeline a little bit. The rate development process for the 2025 plan year started many months ago for insurers and culminates in the division's review of rates filed by insurers, including today's hearing. The division actuaries and staff do not participate in early rate development work until rates are filed, but they may answer questions posed by insurers in the market that have the same question or if the question has broader impacts on Oregon's health insurance consumers. Generally, our annual rate review timeline begins almost a year before rates are filed with the division as insurers review the number, type, and cost of claims they are experiencing. Work on rates kicks into high gear each January. So in January through April, insurers review enrollment statistics, claims history, and market factors to establish a rate request. The division may hold industry actuarial information meetings focused on health policy topics that have a rate impact for the upcoming plan year. The meetings are used to communicate a consistent method of managing rate impacts in the market. The division did not always conduct industry actuarial meetings. Then in May, rates for the upcoming plan year are filed for review and approval with the division. A public comment period is opened, so consumers can review and submit comments about rate requests. The actuaries begin reviewing information filed by insurers. This is the division's first look at the rates developed by insurers. Then, in June, the division continues its review of information submitted by insurers and rate filings. Division actuaries meet weekly to discuss rate information and determine if follow-up with insurers is necessary to understand rate requests. Into July, the division holds this rate hearing to provide an opportunity to share rate filings with Oregonians and seek additional public comments and feedback. The public comment period concludes after the rate hearing and the actuaries review the public comments. Preliminary orders are then released. In August, the division finalizes rate orders and other administrative requirements to ensure plans are ready for consumer enrollment. The filed and approved rates are then transmitted to CMS so they can appear on healthcare.gov. Then in November, open enrollment begins. Then for the next year, January 2025, new plans and rates are effective. Consumers enrolled with a 1/1/2025 effective date have access to new and revised benefits and begin paying updated rates. Next, I will hand it over to Rick Berry to discuss the next slide.
All right. It's a quick overview of the non-actuarial portions of the ACA review process. Although the hearing will only focus on the premium rates filed by insurers in the rate review process, it's important for consumers to know that the division also reviews consumer plan documents, including member handbooks and summaries of benefits. Insurers are also required to file plan-specific information, which includes cost share amounts for specific services under each plan offered in the individual and small group market. During the review of these documents, division staff are able to send insurers questions about plan design and ensure required benefits are included in each plan. The review of plan designs and required benefits also assesses plans being discontinued for the following year. Plan discontinuations can occur for a variety of reasons, including the need to address administrative requirements under the Affordable Care Act when a plan moves outside of the actuarial values specified by the ACA. This is the most common reason for plan discontinuation in Oregon. A network change by the insurer that would alter the availability of healthcare providers to care for consumers under the plan's in-network benefits, and when an insurer stops offering their plans in a service area or in a service area or in all of Oregon. All plan discontinuations require the insurer to notify the impacted members before the start of open enrollment. In most discontinuations, insurers are required to map and automatically enroll consumers into the closest plan available. We've heard from consumers worried about their insurer withdrawing from the market and discontinuing all coverage. Next slide, please. In 2025, consumers can expect to see at least 4 insurers in each county throughout the state. Most insurers operate throughout the entire county. However, one insurer, Kaiser, offers partial county service areas in Benton, Lynn, and Hood River counties. Sorry, let me review that comment. Apologies. Next slide, please. So, required coverages. Essential health benefits are services that are required to be covered by insurers through the Affordable Care Act. Essential health benefits are broadly the list of services displayed on the slide. You can see them there. Essential health benefits are covered, but usually with cost share from the plan member. These are co-pays, co-insurance is paid at the doctor's office. State coverage laws, also known as mandated benefits, outline specific services or provider types that insurers must cover in their insurance contract with consumers. Most mandated benefits allow cost sharing to be imposed and only require the insurer provide access to the service or provider type. One notable exception to allowed cost share is Oregon's Reproductive Health Equity Act that provides first dollar coverage of abortions, birth control, STI screening, and other services. Finally, preventive benefits. Preventive benefits are services researched and recommended by the United States Preventive Services Task Force under the Affordable Care Act and covered with no consumer cost share. Preventive services require first dollar coverage of many services that prevent serious long-term health issues if detected early, including colorectal cancer screening, tobacco use cessation services, behavioral health interventions for obesity, and behavioral health interventions for obesity in adults, along with many others. Next slide, please. So, out-of-pocket or maximum out-of-pocket. Maximum out-of-pocket or out-of-pocket limit is the most you have to pay for covered services in a plan year. After you spend this amount on deductibles, co-payments, and co-insurance for in-network care and services, your health plan pays 100% of the cost of covered benefits. Federal agencies are responsible for establishing the maximum out-of-pocket cost annually. For 2025, the maximum out-of-pocket will be decreasing to $9,200. In 2024, consumers can have an out-of-pocket maximum of $9,450. That's the amount for plans currently in force. Next slide, please. And finally, market-wide benefit changes for 2025. In 2025, Oregon consumers can expect to see one significant benefit change as a result of state and federal efforts related to assisting and containing the consumer cost share for insulin. Beginning in 2025, the consumer cost share for insulin is capped at $35. Also beginning in 2025 is the Basic Health Plan, which will alter Oregon's individual health insurance market by covering individuals at up to 200% of the federal poverty level. The program will have benefits similar to Oregon's Medicaid program. The Basic Health Plan and market movement is part of this year's rate review. All right.
All right,
So-
thank you, Rick.
Yeah.
Thank you, Rick. Now we'll go ahead and turn it over to the division's actuarial staff to discuss the actuarial rate review process.
Thank you, Ethan. My name is Michael Sink, Senior Life and Health Actuary. Tim, Ying, Drew, and I will be going over the high-level process that we do our rate review. This is an introductory level, and any one of these topics we could expand upon. So we're going to only cover the high-level details. If you could go to the next slide, we'll cover the topics we'll cover. I'll go ahead and do that. I'm going to cover the rate filing requirements, which is differentiate between the federal and state requirements, and briefly talk about the difference between individual and small group. I will also go into detail on the administrative expenses portion of the rate filing. Then we'll move on to the actuarial considerations, rate factors, which will include trend, age, area, tobacco. These are the things that you're allowed to rate by, and then the rate stabilization programs. Next slide, please. We'll get started. So there are two sets of requirements for every carrier that they have to fill out. The rates that they file with us are also filed with the federal, with CMS. And I included the references if you wish to look up the details of what's required federally, but it is broken down into three main components. And I'm going to pull directly from CMS some of the descriptions of these items. Part one is the Unified Rate Review Template. This is the standard template that CMS requires all carriers to fill out for all single risk pool plans in the individual and small group market. Part two is the Consumer Justification Narrative. This is a consumer-friendly narrative aimed at the members, providing the justification for the rate increases. So there's no detail in here. That's just the plain language. And then part three is the actuarial memorandum. This is the actuarial justification for the components, the entries in the URRT. And so we're going to leave it at that because we are an effective rate review state. We are actually in greater control of what's required by the carriers. And we have actually been asking for these things from the carriers since before the ACA came into place. So if we can go to the next slide, I'll talk about the state requirements, and I will go into more detail on this one. You can refer to these regulations if you want to see the details here. The first one is the main components that are required in the rate filing, and the second one is specifically the administrative cost component. And I will cover that one a little bit at the end of this. So the main requirements that the carriers must fill out must comply with our product standards, and that is a form of varying length. I think now it's running around 17 pages. 4872. This is the standards for filing individual and small group health benefit plan rates. It's required for every single individual small group plan. It starts out with a rate filing description, which is the cover letter where they explain this is the plain language statement that tells us what they're requesting for the effective dates and covering which products. They have to file the rates themselves, and then they have to file the actuarial memorandum. This actuarial memorandum has to comply with the federal requirements as well as the state requirements. But we do have 6 specific exhibits that we call out that we want every carrier to supply, so that if you are comparing between plans, if you are comparing between years, these 6 exhibits are the same for each particular for every single filing. And the first one is the development of rate change. This is the calculation that gets from the experience period results of the writing period. For this year, it would be the calendar year 2023 experience, and the factors that are used to then price all the way to the rating period, which is for effective calendar year 2025. That's we could go into great detail on that, but this is a high level list. Exhibit 2 is the plan design changes. This is a list of the plans and what's changing in each one of them, so that you don't have to go into each benefit list and try to figure that out yourself. The summary of rate increases. This gives you an idea of how the rates are. There's a range of rates, rate increases that they are requesting, who is most impacted, what are the factors that contribute to those rate increases, and we ask for a specific set of factors for that. Exhibit 4 is the trend information exhibit, and that includes historical breakdown of historical trend, as well as a breakdown of the expected trend that is then used for pricing. Exhibit 5 is administrative expenses. I'll cover that in detail in a moment. And the last one is plan relativities. And this is the difference between you have 2 different plans have a different in pricing, and this is the exhibit that shows what those pricing relativities are. All right, and we do require the URT to be filed to be in compliance with the federal filing. Now, it does not have its own slide, but I wanted to make a few comments about administrative expenses and then the difference between small group and individual. So for administrative expenses, Oregon is the only state that requires or used to be the only state that required an explicit breakdown of the administrative costs, including different types of fees and taxes all split out, as well as salary and internal administrative cost components. We did that before the ACA, and we continue to do that. One of the side effects of this review process, the ACA requires a minimum of 80% or 80 cents of every dollar goes to pay for claims. And the other 20 cents, according to the ACA, is allowed to be spent on administrative costs and profit. However, since we have the carriers justifying the amount of administrative costs they need, and we are able to compare those on a year-to-year basis, ask questions regarding inflation, ask questions regarding the profit levels, we are currently getting requests for loss ratios of 86%, or 86 cents of every dollar is going to pay for claims instead of 80 cents. And that, as a result of just having this information out there and visible, being able to ask questions, premiums are lower in Oregon by 7 to 8% than they would be if we did not have any way to look at those administrative costs. So that was my comments on the administrative expenses. Regarding small group versus individual, the biggest difference between small group and individual is that small group can have renewals throughout the year. And so each filing will have a time differential factor with their rates that will price differently for first quarter versus second quarter, third quarter, and fourth quarter. And so when we get these January filings for small group, we are actually looking at the rates for the entire year. So we are looking at approving rates that are for first, second, third, and fourth quarter, whereas everybody renews on January 1st in individual. This does allow, and this does open up the small group market for what we call a quarterly rate change, and that would be a change on top of, or in addition to, the already approved quarterly changes. And that concludes my section, and we'll move on.
Thanks, Michael. My name is Ying, and I'm going to talk about the actual considerations briefly. In according to ORS 743-018, item 4 and 5, the 5 individual and small group insurance rates needs to be actual sound, reasonable, and the rates cannot be excessive, inadequate, and unfairly discriminatory. And the first one is the actual sound. So this is not a type of sound of music. That means actual sound means the resetting process, including the supporting data, the assumptions, methodology, and calculation all need to follow the actual standard practice. And the second one for the fair, so the rates needs to be fair and cannot be unfairly discriminatory, and the pre-existing conditions are prohibited. That's protect the people that who seeking health insurance in the market, to make sure they're not discriminated against. Next one, reasonable. So the rates need to be reasonable and not excessive. So the rates also only including a reasonable amount administrative cost, and follow the medical loss ratio requirement 80% that Michael just mentioned in his previous slide. And lastly, the rates need to be adequate. So that means the rates need to cover all the costs associated with providing the care. And we also review the company's financial position. So that makes sure that Oregon has healthy, competitive, as well as a sustainable health insurance market. That's all I have for the actual considerations, and I will pass it to Drew to talk about the rating factors. Thank you.
Yeah, thank you, Ying. My name is Drew Bucks, and I'm one of the actuaries here at the department. And today I'll be going over a part of the rate review process that involves rating factors. And so rating factors come into play to determine a member's final premium. I have an example on my second slide, but before I get there, I'll go over the pieces involved. And so starting with trend, this is one of the biggest pieces found in the company's filings. This is one of the areas that our actuarial team spends the most time on in our review. And as mentioned earlier by Michael, this is a topic that receives its own exhibit as part of the filing, and that's Exhibit 4. And so we can break trend down in two different ways here. So there's cost and utilization and medical and pharmacy. And so for cost, that one's pretty easy. It's how much something costs. And for utilization, it's how much something gets used. And we've provided a couple examples here more specifically for each of those two. So for cost, that could be medical inflation. It could also be the provider contract changes between the insurer and the provider. And for utilization, that could be medical care practices, the supply of services, whether there's a shortage or not, and then also the health and behavior of the population itself. And then another way we look at trend is medical and pharmacy. So for medical, that would be inpatient, outpatient, or physician. And examples for pharmacy would be new drugs and patent expiration. And then for each of those two, medical and pharmacy, we also kind of break it down into the cost and utilization of those, like I just mentioned above. And so, like I said, that takes up a lot of our review, and we really look at that very closely. And then on the bottom of this slide, we have some information for the cost growth target program. And we've included it here on the trend slide because we do keep this in mind when we talk about trend. But as shown on the slide, this is run by the Oregon Health Authority starting back in 2019. And here we've given a link to some more information if anyone wants that. And then, so move to the next slide, please. And then, so on my second slide here, I'm going to go into a little bit more depth on some of the other rating factors that we talked about from the agenda. So for age, this is something that's mandated by the ACA and Oregon. It's the same for every carrier. So no company can charge differently based on age. And then there's also a ratio that we keep between ages 21 to 65. And this that's just that. Moving on to area and network, this is just different parts of the state cost more. This can be based on historical unit cost, and then it also goes into provider contracting. So it also depends on which hospitals that they do contract with in providing, or the providers. And then for tobacco, this one is simply if you're a smoker or non-smoker, companies can rate up a little bit more for smokers. And then the last piece here is plan relativity. There are many pieces that go into plan relativity, like copays or max out of pocket. But a very quick and high level way to explain that would be if you have a low deductible, then you would have a higher premium. If you have a high deductible, you would have a low premium. And as mentioned earlier, Exhibit 6 of the actual memorandum provides more info on plan relativities. We also have more information on the next slide, but before we go there, I want to talk about the example on the right side of this slide. So as we're showing here, this is just an example of using $100 as the base rate. And the base rate is what the company comes up with based on all the experience that they've used in the historical experience to come up with their rate for the new year. And then that rate itself, the companies apply age, area, tobacco, and the plan relativity to come up with the member's final premium. So that's how these factors come into play to get the monthly premium. And then next, I'll turn it over to Tim.
Hi there. Yeah, we'll go into the slide with the benefit plan information, please. This a little bit earlier, Rick Berry had mentioned the word actuarial value and talked about how that plays into plan discontinuation. But I plan to kind of explain a little bit more on that. So the actuarial value, we usually just say AV for short, but it's the percentage of expected healthcare costs that your plan's going to pay. But it's an average. So for example, if you have a plan that has let's say a 70% actuarial value, on average, you'd expect the plan to pay 70% of your costs when you go to your provider, and the other 30% would be paid through things like your deductible and your copays and coinsurance and things like that. But this is just based on your essential benefits, and the ACA requires that all plans offered in both the small group and individual market be one of 4 metal tiers. So the bronze is 60%, the silver is the 70%, gold's 80%, and platinum is 90%. And typically the way this works is like the bronze would have high deductibles, high copays, silver less, a little bit lower, and you go all the way on the other side. Platinum has, the lowest deductibles, lowest copays, but at the flip side, platinum will have like the highest premiums. Bronze will have the lowest premiums. So a little bit of a balance there. But every year, the carriers, they have to update their plans using a federal calculator. So each year, the CMS updates their calculator based on, new information, new data, and then they update it for trend and things like that. And so when carriers plug their plan into the new version of the calculator for the next year, so for example, if they take a 2024 plan and they plug it into the 2025 calculator, and let's say, the actual value is too far away from what they expected. So for example, like let's say they had a gold plan, plugged it into their actuarial value calculator, and instead of saying 80%, let's say it says 83%. Well, now they have to make adjustments to the benefits, and sometimes that will cause a plan discontinuation. And this kind of leads into here what we call the silver load. So first, I got to mention that so there's these plans that are available for folks that have low income, and it's a silver plan only. They can select a silver plan that has reduced cost sharing. So, the base silver plan might have had $5,000 deductible, but if they choose one of these cost share reduction plans with the reduced cost sharing, it might have maybe $1,000 deductible. So that's just to kind of help offset their costs when they go to the doctor. On the flip side, to cover the costs of those improved benefits for those folks, carriers charge a little bit higher premium on all silver plans to cover that cost. I should make one little distinction here. When I say all silver plans, I mean just in the individual market. So these plans don't exist in the small group market. And so just an idea of kind of what the size of the silver load is. We put down here, historically, it's been between about 7 to 18%. So what that means is, if the base silver plan without the cost share, the silver load would have been $100. Once the introduction of the cost share reduction plans happened, and the premium of the plan would be $107 to $118. One other thing I'd like to mention about this is that the advanced premium tax credit is tied to the premium of the silver plan, in particular the second low silver plan. I won't go into any more detail on that because that's really outside of the scope of this, but I know that that's something people are concerned about. So if you do have interest on the silver load and the tax credits, you can reach out to OHIM, the Oregon Health Marketplace. Okay, so let's go to the next slide. All right, so this is these two rate stabilization programs here. So the reinsurance, I'll start with this one here. This is for the individual market only. And this is a state-funded program, and we started this in 2018. And this is completely state-run here. And so the way it works is when a carrier incurs a really high-cost claim, the state will pay a portion of that claim, not the full amount, but some portion of that claim, which means the insurer has to pay out less than overall claims, which helps keep the cost of providing care down for that carrier. And in turn, that translates into a reduction in premium that they charge to the members. And so historically, it's been about a 6 to 8% reduction in rates, and it also plays a little bit into the role of how I said previously, the tax credits. And so there's this calculation that goes in to figure out how much money that we can budget for it, and part of that budget comes from an assessment that we put on a variety of different insurance markets here in Oregon. So it's a small amount. I can't remember the percentage off the top of my head, but it's a small percentage, and that money then goes to the reinsurance program. But in addition to that, there's what's called the 1332 waiver, which is where the federal government recognizes that we're saving them money in tax credits. And because we're saving them money in those advanced premium tax credits, they give the state some funds to help fund the program as well. So a portion of it, a significant portion, comes from that waiver amount. So this has been a helpful rate stabilization program. The next one is risk adjustment. So this is for both the individual and small group side, and this is a federal program, and there's no federal dollars involved in this. The money is transferred among the carriers, so it's a zero-sum game, if you will. And the way this works is that the carriers that have higher risk folks, and that would be folks that are older, sicker, have more chronic conditions, they would receive payment from the carriers that had younger, healthier enrollees. And this has a way of disincentivizing carriers from I don't want to say the word, but cherry pick, but to go and choose young, healthy folks and try to not enroll older folks. This makes it kind of a wash in that sense, so that the folks with higher risk aren't the carrier isn't disincentivized to get those folks. And this really matters because the ACA prohibits denying coverage to folks with pre-existing conditions. So, okay, let's go to the next slide, please. Ethan, I believe this is you.
Yep. Thank you, Tim. All right, now we will jump into our insurer presentations and rate discussion. Just to go over the order to begin with, we'll go alphabetically. We'll start with Bridgespan, and then we will move into, hold on, let me get the list up real quick. We'll have Bridgespan Health Company first, then HealthNet Health Plan of Oregon, Inc., Kaiser Foundation Health Plan of the Northwest, Moda Health Plan, Pacific Source Health Plan, Providence Health Plan, Regents Blue Cross Blue Shield of Oregon, United Healthcare Insurance Company, and then United Healthcare of Oregon. So like I said, we'll start first with Bridgespan. So Bridgespan, if you could introduce yourselves and explain your rate request.
Good morning. My name is Dan Bader, and I am a fellow of the Society of Actuaries and a member of the American Academy of Actuaries in good standing. I am employed by Cambia Health Solutions, the parent company of Bridgespan Health Company. For plan year 2025, Bridgespan is requesting a 10.2% rate increase, impacting approximately 300 individuals. The primary drivers of the requested rate change are the increasing cost of medical care and prescription drugs. Similar to 2024, Bridgespan offers only the 3 standard plans, so there are no discontinued or new plans to discuss. Bridgespan offers these plans on a statewide network that remains unchanged from 2024. We invite you to connect with us at bridgespanhealth.com. And thank you for your time. I'm happy to address any questions you may have.
All right, hearing none, we will go next to HealthNet Health Plan of Oregon.
Good morning. I am Doug Hale. I am a Director of Actuarial Services in representation of HealthNet Health Plan of Oregon, and I'm here to discuss our preliminary small group rate filing scheduled to impact the first quarter of 2025. Our requested rate impact reflects an average increase of 7.8%. That reflects a range of a minimum of 4.3% and a maximum of 12.6%. This rate action impacts 3,140 ACA members as of March 2024. We are introducing a new gold level plan to offer additional variety for some of our members, as well as discontinuing all of the non-pediatric versions of our plans. This will assist in administrative costs for Health Net, as well as providing a value add benefit for the membership that currently are enrolled in those plans. We have made additional adjustments to our 2024 plans for the 2025 plan year just to reflect adjustments in the actuarial value calculator and to retain benefits within the AV ranges. I'll slowly pause on each of these slides. We have no significant changes on any of our HSA plans, and we have not made any adjustments to our area factors, network factors. Our age factor has increased by 0.4%, and we are no longer explicitly rating for COVID, as we believe that's part of our base experience, and the run rate for 2023 will continue. And then at the time of this filing, we do not anticipate any significant formulary changes for 2025. And this concludes my summary of our first quarter 2025 rate submission.
All right, thank you. The next company we will hear from is Kaiser Foundation Health Plan of the Northwest.
Thank you. Can you hear me?
Yep, you're good.
All right, thank you. So I'm going to present on both the small group and individual, and I will start with the small group first. In our small group filing, we have approximately 27,000 members in the experience period, and this is on 96 renewing plans, and we have no discontinued or new plans for 2025. Our average rate increase is 6.4% with a minimum of 2.1 and a maximum of 15. The primary driver of the rate increase is a change in medical costs, including service costs related to nursing shortages and such. There are no rating factor changes for 2025 and no changes to the geographic service area. We have no significant changes in our plan designs, only changes related to maintaining metallic tiers. For the individual rate filing, we have 34,500 members as of February 2024, and that's on 14 renewing plans. Actually, I believe it was 13 renewing plans and 2 terminating plans. The 2 terminating plans are being removed to comply with maximum plans per metal tier requirements. The rate increase is an average of 4.37% with a minimum of minus 0.22% and a maximum of 14.64%. And again, the primary rate changes are changes in medical costs, much like small group. The impact of the basic health plan is a reduction of 2% on our average rate increase. And this is primarily driven through an estimated decrease on our silver loading of about half. So from approximately 13% to 6.5%, 7%. We have no changes in our geographic service area and no significant changes in our benefits or or plan designs except to keep up with the metal tiers. We have no major changes in our formularies for 2025 either. And this concludes my presentation.
All right, thank you. Next, we will go to MODA Health Plan. Do we have MODA on? All right, well, we'll go next to Pacific Source, and if MODA is able to join after that, we'll check in with them. So Pacific Source.
Hello, this is Benjamin Shade with Pacific Source, one of the actuarial managers, and I also have Clara Combs, our actuarial director, on the call with me. I'm just attempting to share the presentation right now. All right, is that showing up?
Yes, thank you.
Okay, great. I'm going to present on Pacific Source's individual and small group filings for 2025, and we'll start with individual. All right. So for our plan offerings in 2025, you can see the breakdown here of how many plans at each meta level. The only difference between 2024 and 2025 is that we have 2 bronze plans that are being discontinued. So those plans being discontinued are due to the federal limitation on the number of plans that each carrier can offer at each meta level. And also these 2 plans being discontinued are similar to the Oregon standard bronze plan. So that's our bronze 9400 plan, both exchange and direct only. As far as network changes, there aren't any network changes. So our Navigator network will continue to be offered statewide. Pacific Source is requesting an 11.6% premium increase in the individual market. And the main driver of that continues to be increasing costs of medical claims. In our filing, we used a medical trend of 9.5% and pharmacy trend of 10.8%. For benefit changes, as mentioned earlier, the reduction in the out-of-pocket maximum limit of $9,200 affected several plans, and other smaller changes were made to mostly keep plans within the respective AV metal levels. One new coverage that was added for 2025 is hospital-grade breast pump rentals, and that falls under the durable medical equipment benefit. For pharmacy benefit changes, as the division mentioned earlier, there was a reduction in the cap on out-of-pocket costs for insulin. And then in addition to that, coupons and other third-party payments for prescription drugs will be included in the calculation of member cost sharing. So those will contribute to the deductible and out-of-pocket maximum accumulators. If you have any questions about our individual products, you're welcome to contact a coverage advisor at the phone number shown here or the email address coverageadvisors@pacificsource.com. Next, we'll move on to the small group rate filing. Similarly to individual, you can see the breakdown of plans offered by meta level. And again, the only difference is that we are discontinuing 2 of the bronze plans. For the same reason as individual, that these plans are very similar to the Oregon standard plan, and also due to a lack of consumer interest in these 2 plans. So that's our Navigator Bronze 9400 and Voyager Bronze 9400 plans. aren't any network changes. So our Navigator network will continue to be offered statewide like individual, and then the Voyager network will continue to be offered in the 4 counties listed here on the slide. Our small group filing is requesting a rate increase of 5.7% on average. And similar to the individual filing, the main driver of that increase is increasing medical costs. We used a medical trend of 9.1% and a pharmacy trend of 10.4%. The changes in benefits is exactly the same as individual. The reduction of out-of-pocket maximum to $9,200 and the addition of the hospital grade breast pump rental. For changes in pharmacy benefits, this is also identical to individual with the insulin out-of-pocket cap decrease and coupons applying toward member cost sharing. If you have any questions about our small group products, you can contact us at the phone number included in the slide or any of the area-specific email addresses listed below.
All right, thank you.
Yes, you're welcome.
Next, we will go to Providence Health Plan.
Good morning. Wait for our slides to come up. Thank you so much. Good morning, everyone. My name is Shannon Drotning. I'm the market president for our consumer and specialty lines here at Providence Health Plan. With me today, I have Andrew Chung. He is our certifying actuary and our senior manager, and as well as Lou Flacco, our chief of underwriting. I want to thank you to the division very much for having us today. And we're here to go over our 2025 individual and small group rate filing. With that, just a quick agenda. We'll have a slide a little bit about us. And next we'll move into our individual plan, the changes and the rate filing request. And then we'll move on to small group. And then at the end, we'll share our contact information. So with that, first, I want to give a little background. Providence Health Plan is a mission-driven company. We are local and we have been in this community for over 40 years. We are a nonprofit organization as well, and we are serving all counties in the state of Oregon, and we actually are the only carrier that have served all counties in the state of Oregon for the duration of the Affordable Care Act. So with that, I'd like to move on to individual. For individual and family, not much is changing. We have no terminating plans. All 14 of our plans are renewing. 9 of our plans have slight benefit modifications, most of that having to do with remaining compliant with the actuarial value calculator. No new plans will be introduced. We don't have any changes to our network or any service area changes. With that, I'll turn it over to Andrew to talk about the rate filing.
Thank you, Shannon. For 2025 individual market, Providence's requested rate change on average is 11.2%. The range of the rate change at a minimum is 4.3% to the maximum of 18.1%. The requested rate change will impact about 44,000 members in our individual plans. The main driver for the requested rate change is the growing cost of the medical care, as well as the cost of prescription drug. With that, I'll turn it over to Lou for our small group.
Thank you, Andrew. This is Lou Flacco, and I want to go through our small group plan portfolio for 2025. There are no terminating plans for 2025. We are renewing all 39 of our existing plans, with 15 of those having benefit modifications for lowering deductible and out-of-pocket maxes for the actuarial value compliance. We are not introducing any new plans. We have no network or geographic service area changes for 2025. And with that, I'll turn it back to Andrew to talk about the filing.
Thank you, Lou. For 2025 small group, Providence's requested rate change on average is 16.3%. The range of the rate change at a minimum is 9.2% to the maximum of 26.3%. The requested rate change will impact about 46,000 members, or roughly about 5,000 small group employers. The main driver for the requested rate change, similar to individual, is the growing cost of the medical care, as well as the cost of prescription drug. Now with that, I'll turn it back to Shannon.
Thanks, Andrew. To contact us, our website is providencehealthplan.com. And with that, I want to thank the division and thank you everyone for your time today.
All right, thank you. Next, we will go to Regents Blue Cross Blue Shield of Oregon.
Good morning. I'm Lisa Mudgett, and I'm joined today by Dan Bader and Chris Jasperson. All three of us are fellows of the Society of Actuaries and members of the American Academy of Actuaries in good standing. The three of us are employed by Cambia Health Solutions, the parent company of Regents Health Plans, and a tax-paying not-for-profit company serving nearly 1 million Oregonians annually. We're here today to share details of our rate requests for 2025 individual and small group ACA health insurance products. Dan, are you taking this one?
Sorry, I was on mute. Thanks, Lisa. As Lisa mentioned, my name is Dan Bader, and I'm the actuary with Regents. On this slide, we give the high-level introduction to the individual and small group rate filings. On the next slides, we'll look at each line in more detail, followed by how you can contact us. Regents is requesting a 9.3% rate change for its individual line of business and a 13.6% rate change for small group. As noted on the slide, these rates reflect what we expect care to cost in 2025, and the main drivers are the rate changes are the increasingly high prices associated with medical care and prescription drugs. Looking at individuals specifically, as mentioned on the prior slide, we are requesting a 9.3% rate change, and this will impact about 35,000 individuals. This filing does contain plan discontinuations resulting from the limits placed on the number of plans a carrier can offer. In 2025, we are offering 15 plans in total across 2 networks. The networks are the same as offered in 2024 and include a network offered in partnership with Legacy Health Partners in select counties, along with the individual and family network, which is a broader statewide network. Regarding plan modifications, our plans were modified as necessary to align with out-of-pocket max limits, IRS changes for the HSA plans, and to meet actuarial value requirements. I'll now hand it over to Chris to discuss small group.
Thanks, Dan. The small group rate change is requested at a 13% annual increase. A lot of what happened in small group is very consistent with the individual plans. The main driver of our rate increase is the increasing cost of care on the medical and prescription side. We did discontinue 5 plans and issued 2 new plans. The discontinuations were due to low consumer interest. We continue to offer 2 networks, Broad PPO and our, as Dan mentioned, Legacy Associated Network. We made some minor plan modifications to maintain compliance with the regulations and AV calculator, but otherwise our covered benefits remain the same. And at this point, I'll hand it back to Dan.
So here you can see, if you want to contact us, we have all of our social media platforms that we participate with, and then you can also go to regents.com. And if there's any questions, we are happy to take those.
All right. Thank you. Next, we'll go to United Healthcare Insurance Company.
Can you hear me?
Yes.
Nice. Good morning. Excuse me. Good morning. My name is Bill Zhang. I'm with United Healthcare. Today I'm going to present both of our entities. First, I'm going to go with the United Health Insurance Company. I will cover the summary of products, network changes, rate change request, and the rating factor changes. There will be 19 plans in our 2025 portfolio, all from 2024. So there are 17 plans from 2024 terminating to optimize our portfolio. This will impact about 7.5% of our members. And we're going to map them to other comparable plans. And there's no new plans for 2025. The benefit changes are very minimal, just to make our plans AV compliance and also appliant to the maximum out-of-pocket for 2025. Our network for 2025, there will be two networks continue to be offered from 24 to 25. Which are full network choice plans and full network Nexus plans, which was introduced in 2022. And our narrow network in Navigate will be discontinued in 2025. The rate increase for 2025 on average in all 4 quarters is about 13.2%. The range is from 10.6% to 20.4%. And the total impact of plan mapping and benefit changes is negative 0.1%. Our quarterly trend starting from 1/1/25 is 1.8%, which on annual basis is 7.5%. And the filing will impact 9,520 members in total as of March 24. And again, there are 19 renewing plans and 17 discontinued plans. Rating factor changes. Our filings changes base rate from last filing, which was 1Q24. And quarterly pricing, pricing trend changed from 2.3% to 1.8%. And we also changed our plan relativities. There's no changes on the area factors and other factors. So for more information, you can visit us on uhc.com. And that's it for United Healthcare Insurance Company. Then I'm gonna go with our other entity in United Healthcare of Oregon.
Great, thank you. Go ahead.
So we only have 2 standard state standard plans in our UHC of Oregon entity, which are standard bronze and standard silver. This is not changed from 2024, and no discontinued or new plans for 2025. The average rate increase for 2025 is 13.8%, ranging from 12.7% to 14.8%. The quarterly pricing trend is also 1.8%, on annual basis of 7.5%. And there are only 3 members in total as of March 2024. And this is same as UHIC. The changing from 1Q24 base rate, quarterly pricing trend, and plan relativities. And same, you can also contact us with information on uhc.com. That concludes my presentation. Thank you.
Great, thank you. So that wraps up our insurer presentations, and we want to thank you all for making your presentations. Consumers are encouraged to provide feedback about the rates proposed by insurers. We do consider public comments submitted during the rate review process before rates are finalized. The division reviews any comments we received in alignment with actuarial principles we described in the hearing. We also consider consumer comments in relation to public policy about the cost of healthcare. Oh, yes, TK.
Oh, just really quickly, Ethan, I don't know if we still needed MODA to present, but I think somebody from MODA is on the call.
Oh, great. Do we have someone from MODA?
Yes. Unfortunately, I am not actually prepared to present. I apologize very sincerely. We were under the impression that this rate here reading, we just had the date wrong on this. So unfortunately, we have not compiled the answers to the questions that were laid out for us to present. However, we can provide that at a future point if you would like us to. And in the meantime, modahealth.com would be the appropriate way for consumers to get in touch with the company to let us know any concerns or questions that they have.
Sure. Mark, if possible, I understand you're unable to answer all the questions. Would you be able to just even briefly describe your rate filing for the 2 markets, just even the request and maybe any drivers? If not, that's totally understandable, but.
And again, I don't even have the final increases that we have submitted in front of me. I really apologize. I was informed that this meeting was going on about 7 minutes ago. So I've been trying to find the information, but unfortunately, we, like I said, we just had the date wrong, and I wasn't informed that the meeting was going on until just moments earlier. So I apologize.
Okay. Oh, yeah, understandable. So the information, including the full rate requests, are available at OregonHealthRates.org for anyone who wants to take a look at those. And we'll go back to our public comment period. So at this time, I'll go ahead and open the floor up for public comments about the filings. If anyone would like to make a comment, please state your name for the record and which insurer's rate filing you're commenting on. The division will review comments before making a final decision on the filings discussed today. So I will now open it up for any public comment. All right. Well, hearing none, that's quite all right. We do accept comments online through our website, www.oregonhealthrates.org. Next, we'll go to the additional resources slide. After rates are finalized, consumers can still reach out to the division if questions or concerns about insurance coverage in Oregon arise. Division consumer advocates handle complaints and questions from Oregon consumers who are experiencing difficulties with insurers and insurance products regulated by the division. Advocates use their industry knowledge to analyze and resolve complex issues. The Oregon Health Insurance Marketplace, or OHIM, is Oregon's Affordable Care Act marketplace where consumers have access to health insurance coverage using tax credits established under the Affordable Care Act. Oregon's Health Insurance Marketplace also provides technical assistance if your marketplace coverage hits a snag and is also an excellent benefits resource. So next steps. Although the rate review process for 2025 is winding down, there are a few more steps before the rates are finalized. Rates currently under review will be in place beginning January 1, 2025. After the hearing and public comment period concludes, the actuaries will meet to discuss public comments received by the division. The division may also consider additional information requested from insurers. The actuaries will meet with the insurance commissioner, Department of Consumer Business Services Director Andrew Stolze, and present rate recommendations for his consideration. The rate recommendations will take into account the items we discussed earlier, as well as consumer feedback. All rate recommendations are made with a series of 3 administrative orders that formalize the rate review process: the preliminary order, the proposed order, and the final order and final rates for the 2025 plan year. The plan and premium rate information is transmitted to healthcare.gov, where it'll appear during open enrollment beginning on November 1st, 2024. As we wrap up today's hearing, I'd like to thank the division actuaries, Michael, Ying, Tim, and Drew, our project manager support, Keith, our health intake analyst, Mary Ellen, division and agency executive support staff, Yasmin, Amy, and Alicia. I'd also like to thank actuaries and their support within their organizations at each insurance company. And that concludes today's hearing. Thank you, everyone.